So I was tasked with trying to do some archaeological digging about what kind of problems autistic people face in Finland, which is a lot really, and it goes on and on, especially nowadays. But yeah, I think the two main points are basically the social services and the healthcare. And then we also have to fight the problems that we have with parents when we are young, and the obstinacy of services when we are old. And at all points, the difficulty is in getting through to these people and have them actually listen to us, even if and when we are different. So it's a sort of we live under the boot of the neurotypical people. And I try to do this chronologically and list all kinds of difficulties that we face when at a certain phase of life. It's actually this phase of life is being used to deny us care as well. It's a new law by the government that they are going to get through, and the disability services are vastly trying to fight it. And we even got a mention from the UN that this is not okay. And disabled people need services despite in what life situation or in what life phase they are. But yeah, I think the first problem is the delayed and protracted diagnosis, which is really that autism isn't recognized. It's just if we had missing arms or legs, it would be very easy to recognize everything. They could see it at first go that we are different. But when, for example, you read a lot of books, that's not something that you go to the doctor for. Oh my God, my child is reading 10 books a day. This is amazing. No, they are just proud of it. But then it's the classification into you being normal continues, and it leads to problems, especially retroactively as well, because then there are only markings of you, like in the social services and medical services, of you having been normal, maybe a bright child, but normal. So you can't backwards prove it. And when you can't do that, they can say that no, there have been no signs, even though there were. So yeah. We are also perceived as difficult because, as many know, autists have very sharp boundaries. Let's call it like this. I know that I think very much in black and white terms, and I don't see it as a problem myself, but it can be a problem sometimes. For example, my mother, who is probably also on the spectrum, she has this autistic rage, even though she's already 80, she just blows up when things change. She is not very good at handling change. But the next day, she has being able to process it, and then it's a much easier time. But yeah, this is the people close to us, they will understand it, but at least relatively understand it. They will maybe see it as something of our personality or our nature if they don't have the words to call it autism. But the doctors and the medical staff, they often don't even have that. The child is trying to be kept normal for a very long time. And then there is the opposite as well, because if you get into this this not normal pipeline, you can get institutionalized. Well, you know what I mean? But basically then you go into this process, and the process can be very dehumanizing, just as well as not being like recognized as an autist. So there you go. And I think like the point here is that the doctors definitely, given how much they get wages and everything, they should recognize these things, and they should be like in an even manner. They should be able to understand these things and recommend what to do so that autistic children get the special care that they deserve and special opportunities even in early childhood. Like if you have interests that do not align with the neurotypical people around you, it's just like it's ignoring you. It's ignoring what you are. In institutions, they sometimes use sedation to make the child pleasant. And I've read even of cases, this is from the teenage years already, that it can lead to like life-threatening situations, that you get too much of these neuroleptic drugs. For example, Seroquel is used in the US. Here they use Ketipinor, I think. And just like way too much is used, they can lead to like your heart stopping and stuff like this. And the doctors in Finland very rarely get problems with this kind of stuff. Like there is this idea of like collegiality, and they are supposed to like protect each other. So it's a bit like a mafia, but I mean, like it's good when it's for the right reasons, but it's not good when it's used to like protect a corrupt doctor or a corrupt system. In those situations, they should be called out, and we should get proper care. And the same is true for parents as well, because like parents, of course, tend to love their children. So when the parent attacks the doctor, the whole family can be closed out from services effectively. Like on the paper, they get care, but otherwise they are just like ignored and sidelined. Then there is the problem of fragmentation. In Finland, the medical services basically are a bunch of hills. We have one hill for the internal diseases. We have one hill for psychiatry, one hill for sleep disorders, and there is like a lot of different hills, and the hills don't communicate with each other very well at all. They are like basically like I think of them like as a fantasy country, and each of the leader of this hill, the top doctor or whatever, is like the king or the queen, and then they reign over their territory and try to like keep it so that they don't admit like stuff from the other kingdoms. But yeah, it's a mess. But I've heard that there is actually going to be like there is an increased push to get the different hills, the different areas of medicine, like a specialist medicine here to talk with each other. So I have some hope for it. But for example, like when I've been trying to get a disability pension now for since 2019, every hill will just like report their own stuff, and I still don't have any kind of like a paper which would list like all of my issues. There are like some issues are listed in papers which are years old, and some listed like a far fresher paper, and then it's like easy for Kela, which is basically a public insurance company, to deny pensions and other kinds of benefits. So they can just say this is too old, and it's like a hamster running in a wheel. But yeah, then there is also the issue of masking, which is I've personally have to deal with it many times. It like one of the doctors that I know say that it's a fashion word now used in psychiatry. euthymic means that you look like you're evenly happy, like you are calm and you look like everything is basically all right. And everybody knows that, at least everybody here knows that as autists, this is not true for us. Like we can look like we don't have any expressions at all. And that's like inside we can be screaming. It's like, it's not euthymic. And I've had this euthymic like written to my own papers in absolutely like insane situations. Like one time I was in the psychiatric care as an outpatient, and I was like begging for the psychiatrist for euthanasia because I was like in a very bad situation of life then. And the psychiatry wrote to my papers that I seemed euthymic. It just seems so absurd. Like it's insane. But yeah, this is like the stuff. And when you try to fight this stuff as an autist, it's very difficult because you're like you're different from the start, and you're seen as something of a weird, whiny person from the start. Yeah, then the early school years. Here again, I think support is often denied. For example, to my sister's child, who is trying to get, well, they both are trying to get like services for her. It's just denied again and again. Like she has had every kind of non-medical support for her ADHD, and she's very probably ODHD. So she has both autism and ADHD, and it's just like they are saying that first you have to like see if like these other support thingies help. Well, then they did that, and they didn't help. She still had problems. And then the psychologist who is somehow, or who was somehow like in charge of this whole thing, said that because she now has all these supports, she doesn't need more care, even though she did. So it was just like an illogical explanation how to proceed. But now I think the psychologist is no longer working there and the fight continues. But meanwhile, like children grow up pretty fast, and when you get behind in school, it's not that easy to like trying to catch the others afterwards. And it can mean like you lose your friends from the class where you're in, you lose maybe your like the teacher that you know, and so on. It's like basically like you get sidelined, like ostracized in a way. In Finland, we have this word for it called syrjäytyminen. Perhaps Heta knows the word in English. Well, it doesn't matter that much. And yeah, then there is mismatch of school structures and autistic rhythms. For example, the school in Finland is very often arranged so that it begins in the morning and ends in the afternoon. And this is like the typical way. But many autistic people have this, that they don't have like regular sleep rhythms. For example, I'm personally diagnosed with a G47.2, which means that I don't essentially have a sleeping rhythm. My length of my day is something around 30 hours, even more, and it's just very difficult for me to like have any idea when I will be up or no. So I have to use like sleeping aids to be able to make some very important meetings. And I remember when I was at school, like primary school, I was tired all the time. Like I was just exhausted. And in Finland, there is this push for children to getting work experience as fast as possible. which means basically that when I was like 16 years old, I think, my parents were already pushing me to go to work. And so I was doing some kind of street interviews and stuff like this, and it was kind of a lot because I couldn't like even do my homework stuff anymore. I was like, I just wanted to be left in peace many times. I wanted to spend time with my computer, with like people I like, with my friends, playing role-playing games and stuff like this. But yeah, I still got good marks, but it was like, it was definitely like not aided by any kind of autism services. And there were, of course, no regard for stuff like for the sensory issues. Like if you ask, could you like put the lights out from the class? No, they can't. And it would be silly even to ask in their mind. So yeah, but I've actually like the last disability social worker that I saw, she had been the only person now who actually asked me when I went to her office if I would like to have the lights switched off, and it was the first person and first time I saw her. I was just like blown away, like somebody actually recognized that this could be an issue. It was wonderful. Then there is, yeah, the truthfulness. I remember there was this one occasion in a physics lesson that I was like getting really peeved for the physics teacher. This was in secondary school, and he didn't like, I thought that he didn't like take everything necessary into account. And I was like, well, how will the background radiation affect like the electricity lines? And like, doesn't it have some kind of like energy of movement, and won't it like degrade the lines when it like continues? And then like it was an honest question for me, but yeah, it definitely wasn't like he thought that I was just like being an ass with him. Then there is like the teacher preparation. So well, this was really in the university already, like back there I was really studying very well, and the teachers just like couldn't handle me as an autistic student. Like it was unlike something that they had ever known or seen, and I asked a lot of questions. But yeah, let's go forward. You can see the new slide. I was just looking that I can see my own face in the slide window.
Looks fine.
Sorry?
Looks fine.
Yeah, that's great. That's great. Okay, so now it's adolescence. And here at the ages, I think nowadays it's 18 probably, because like the previous government raised the mandatory studying age. So until that we get the adolescent services. And I have some thoughts about it. Like I think like it can be problematic if the autistic person, the autistic like teenager, wants to do something else than what is like presented by the regular school. And for example, if at 16 they would want to go to like some kind of specialist vocational training somewhere to like train under some kind of like apprenticeship, for example, let's say for crafts or something under a single person, I think it would be difficult in the Finnish system. Like they might be able to pull it off, but officially they have to study until 18, and there might very well be like problems in looking at if will this be covered, like is this something that you can already do or not. And then there are of course people who are like not ready to study, and it will just like lead to people who are not ready to study acting out in class. And some of those people may be autists. I mean, like when you put autistic people in a frustrating situation, which continues year after year, it's going to lead to meltdowns. Then there is the Kela. I personally call Kela the slave office, but it's like the Finnish public insurer of people. And autism is definitely not recognized very easily. For example, just this year is the first year I'm 45. Is the first year that I get disability benefits because of autism. And I've been diagnosed as autistic for some 15 years now. I just didn't even know how to like get for those or something. And I've heard that Kela has been instructed not to tell about these things unless the customer asks. So they are trying to cut like all kinds of money that they would have to give out. And when you apply for them, it's still very often going to be a fight. They will give you like the lowest possible amount of money. But yeah, it's already easier. But I've had to fight for electricity, for water, and for my rent to be covered. All of those by Kela. I've had to fight for my medication. Like all of this is a fight, and it's just basic human rights. It's very tiring. And then there is also that like autism can make you so disabled, or you can be so disabled because of autistic traits that it's just impossible to work in a regular environment, which is like basically made for neurotypical people. And then autism isn't seen as something enough to get you like a disability pension. And the disability pension as well is like being demonized. They are saying that the pension is like it's like basically the end of your life, even though it's like quite the opposite. Like you can work for some almost 1,000 euros a month when you're in the disability pension, and further on, like you don't have to be constantly afraid of like having a home or having food or stuff like this, which is especially horrible for autistic people. So all this accumulates in stress. It's like stays unresolved. There is basically like no easy ways to get support. You're not told about these supports, and your parents are not told about these supports, and they might even have this sort of like this Stockholm syndrome, that they have this ideology that you have to work and you have to be normal, and God forbid if you're not normal. So yeah, then many of the parents will fight the idea of their children being autistic. Not all of them. Some parents are able to recognize it fairly quickly and see like this is like the child that I love, and the child being autistic is just like all the more reason to love. But yeah. Then early adulthood. There is the vocational rehabilitation. I think that from what I understand about vocational rehabilitation is that it's basically like going to work somewhere but not getting paid. In some lucky situations, you might actually get paid, but often it's just like working for free. And at least to me personally, it feels unfair. Like stuff like this shouldn't be like if you work, you should get paid. Otherwise, it's really one-sided. And yeah, when I would insist on this kind of fairness, I would be labeled difficult, and I have been many times. It definitely happened. Like in one occasion when I was something like 20, I was in the Geological Institute of Finland, and they didn't pay me anything, but they expected me to be there for like 8 hours per day doing the work that they were doing, so that they wouldn't have to do it. And because I had to pay my rent, then I was away for some days and doing actual work. And then this led to like this blowout with the boss, where the boss said that I need to be there, and I have like this kind of responsibility. And I told her that like, yeah, I can be there if she pays my rent. And yeah, I didn't get very good marks from there. Then there is the housing and daily support. I also get those now. It's like I could have gotten those in early adulthood, but adulthood, but I'm getting them now. And the housing guidance works basically that they come to your home and they help you do all kinds of bureaucratic stuff, like for example, applications to Kela. And it's been a vast help, but they only work in basic daytime hours, like from 9 to 16, for example, or 8 to 16. And it's been many times like I've had to like be awake for 24 hours and then receive them, because otherwise I would just like miss the meeting. And there is only one meeting per week, and like I have so many issues that I need to like take care of, so many social issues and legal issues and every kind of like this. It's this fight to get your rights and yourself recognized in the system. And there is just like I try my best, but I've missed a lot of appointments because I need to sleep. And it's hard to like receive somebody at your home when you've been awake for 24 hours. It's just like your brain doesn't work. And then there is the medical stuff. I think I mentioned some of those already. So masking essentially for me is that I go to the doctor and I try to like seem as efficient as possible. I don't want to like make a scene at the doctor. And I try to give them every necessary information fast, and I talk in this like even voice, and I try to be logical and so on. So they think that there is something wrong with me. Like, but this is basically me like trying to be 150% of what I can be, and it's very tiring. Like I dread those occasions, and then the doctors write something like completely off about me. Like they think that it's like there was like Superwoman, and that's it. Like nothing's wrong. So they don't actually listen to what I'm saying. They just like look. Truthfulness is another thing. Like if I start to backtalk them, when I like some of those doctors will just like they will lie to you in Finland. I've been lied to many times so that I've caught the doctor in the lie. For example, one of the doctors had this like this when I had very bad headaches back in the late 2000. The doctor said that in the expert neurology care, they don't treat headache patients. Then I went to see another doctor. They were both like private doctors. And the other doctor sent me to the public neurology. And the first doctor was there to receive me. The same who had said that there is like no services at all for headache patients. And then there was a headache service. So yeah, it's this kind of stuff, I think, as an autist is especially difficult because it's like you can't trust the doctor anymore, and you can't even trust the system anymore. Like it feels so wrong. And then there is also this, that when you try to really like have a lot of understanding about your own issues, because nobody's helping you really, and then you try to present it, then they are saying that you are rambling. Like it's like she's just rambling on, like, which is another clue that they are just not listening to you. It's just one more way to sideline you when you are actually giving them important knowledge. Then there is the LGBTQ issues also. There is prejudice, invisibility, like sexuality and gender issues can present differently in autistic people, and when they don't recognize autism, they don't definitely recognize autism, which is like even more even more complex. Like the further you are from the normal, the more difficult it seems to be for the system to recognize you. The private sector works a bit better, but the public sector, like it doesn't really work well at all anymore. I think like if people here have the choice and can afford it, they should go to the private sector first, and there they may receive better care, like because the doctors there, when you pay them, they are also are ready to listen to you. In the public sector, we have huge queues, like we can have half a year of queue, for example, in the area where I live, just to get to see like the basic doctor for something which is not like it has to be done right now. So this leads to like a stratification of the society, like the poor get poorer, the poor don't get the care they deserve, and they just get like they face more medical issues, while the richer can solve these issues, and they have vastly different. Sorry.
I think we should wrap up in about 5 minutes to stay on schedule.
Oh, 5 minutes. I still have 2 dias. I will be as quick as possible.
Okay, thank you.
So yeah, then the middle age. Basically, there is a lot of accumulated damage already during the middle age, and the doctors already start to like sideline you the more like the older you get. Like this is normal. Like it's a way to deny care. The pensions, which become especially pertinent at this year, is like they sideline those as well. They sideline them when you're young, and they sideline them when you're old. And of course, you have less energy to like fight about the issues. The typical way is this, that you're too impaired to work and not ill enough for pension. And for caregivers, which are also often old then, or middle-aged at least, it's like exacerbated problems. It's like they have to carry themselves and also carry you when you don't get like carried somewhere else. Then the old age. Now there is like the law that I mentioned, that because you're old, you're not deemed able or eligible for this disability care issues anymore. Like you will get treated just like the other people, which is like you get a poorer standard of care. They somehow think that because old people have similar problems, autistic problems just disappear into the same thing, which is of course not true. This leads to increased isolation, which is already a problem for autistic people. Like we tend to go into our own like small safe spaces, and still we may yearn for social contact and where to get it. Like it's difficult, for example, if you can't walk or can't move properly, and they will try to deny you any kind of like chauffeurs or something like this. And there is like this idea that I had that in addition to autistic rage, there is neurotypical rage, which is basically like when you try to get services and try to get your human rights met, you are met with neurotypical rage. Like first they are irritated and they try to like silence you in becoming like irritated like this. Then there is like stuff that doesn't belong to any life category in as such, but is more general. Denial is the typical first thing that people face in Finnish services. Like first, you are at position 0, like your position 0, you don't have anything. Then when you, like the actual needs and problems that you have are not listed, you don't get a diagnostic code for them. And when you don't have the diagnostic code, the issues effectively don't exist. Like the slave office doctors look at them and they look at them and say, well, you don't have this issue because you like, there is no code for it.